What ethical issues arise from harmful patient choices? Imagine a patient refusing a treatment that could save their life or choosing a risky procedure despite clear medical advice. What kind of ethical questions does that raise? Let's explore this together. When patients make choices that could harm their health or others, healthcare workers face tough decisions. These choices challenge the core principles of medical ethics. Respect for a patient's right to decide is important, but so is doing good and avoiding harm. For example, if someone refuses a blood transfusion for religious reasons, doctors must respect that decision but also worry about the risks involved. Assessing whether a patient can truly make informed decisions is another key issue. Some patients might have mental health issues or cognitive impairments that affect their judgment. Healthcare providers need to carefully evaluate if the patient understands the risks and consequences of their choices. If they don't, interventions might be justified to protect the patient's well-being. But this can be a delicate balance. Conflicts often come up when patients reject medical advice or choose treatments that go against clinical guidelines. Doctors and nurses want to follow evidence-based practices, but they also need to respect patient autonomy. Open, honest conversations are essential to find common ground. It's about understanding why a patient makes certain choices and explaining the potential outcomes clearly. Harmful choices can also affect others. For example, refusing vaccination can put family members or the community at risk. Healthcare providers might then face ethical questions about when it's acceptable to intervene to protect third parties. Legally, they could be held responsible if harm occurs because of a patient's refusal. Healthcare workers may experience moral distress when they feel unable to prevent harm or when they participate in treatments that conflict with their personal beliefs. This emotional strain can impact their ability to provide compassionate care. To help navigate these complex situations, many hospitals have clinical ethics committees. These groups review difficult cases, weigh ethical principles, and support staff in making balanced decisions. Using ethical decision-making models can guide providers through these challenges. They start by assessing the patient's capacity and understanding, then communicate compassionately to explore their reasons. Before overriding autonomy, less restrictive options are considered. Documenting the process and consulting ethics committees ensures transparency and fairness. In the end, harmful patient choices highlight the tension between respecting individual rights and protecting health and safety. Addressing these issues involves careful assessment, honest dialogue, and support from ethical frameworks and committees. This way, decisions stay aligned with both ethical standards and patient-centered care.